Yeah, so we actually put this cover in two long-term acute care hospitals that were having a C. diff problem. They had tried all of their other things. They had tried antibiotic stewardship, and they had tried proton pump inhibitor limitations and hand washing compliance, and they couldn't break the problem. They weren't as bad as some hospitals. Some hospitals are running 30, 40, 50 CDIs per 10,000 patient days. I mean, that's ridiculous, okay? They were running about 12. We put the cover on for 14 months, and we cut their rate in half in both of them. So we prevented about 20 CDIs, so value about 600,000 at least, okay? Probably more than that. So huge, we were able to do it, and we had no change in pressure ulcers. In fact, we actually decreased them a little bit, but it wasn't statistically significant, so can't take credit there. But you know, with no problems with pressure ulcers. We had no problems with regular EVS staff using it, and so it worked. We really decreased it. Now we've put it in another hospital in the Northeast, and they want to publish their own results. So, but what I can tell you is they basically wiped their CDI rate out. They just completely wiped it out by putting it in the units they put it in. And what they found was they were doing everything in 5 different hospitals trying to decrease CDIs. They had, doing all the antibiotic stewardship, no change in anywhere except for the 2 units that had the cover, and they wiped it out. So I'm sorry, the cover works. We had another hospital, was interesting, that's using the cover, and they said, oh, we're going to replace our mattresses. You've convinced us we've got probably defective mattresses. They probably got, breaches, and they probably have a microbiome on them. We're just going to replace them all. We're still going to buy you covers to protect them. And guess what happened? When they replaced all the mattresses, they wiped out their CDI problem. Now, they bought the covers because they want to keep wiping out, because they know the microbiofilm is going to restart, and they know they're going to destroy their mattresses because they're using peracetic acid, which is not compatible at all with these mattress covers. It's a good cleaner. It smells horrible, but it does clean. So they've done that. So there's more and more hospitals that are really seeing the value proposition here. It's really clear. I mean, it's so much a return on your investments that's just unbelievable. Even if you said, I'm not going to prevent any CDIs, which you will, okay? You can prevent other infections. But what's going to happen is you're also going to protect your bed asset. These mattresses cost $1,500 to $3,500 to replace, okay? And the bed deck, when you get the rust there, you're not supposed to keep that bed in service. That bed's supposed to come out of service. $5,000 to replace the bed deck. All you got to do is prevent a few damaged asset, and you paid for the covers all day long. Your EVS workers will have quicker turns to the room. So you need a quick turn to the room, but a clean room. You give them an hour, they put the cover on in that hour, but they actually do clean everything to a high level, including the handrails and everything, and all of a sudden, you decrease your infection rate. I challenge any hospital to either clean better or put the cover on. They're going to see a change.